Colleagues, what we see here is continuing my presentation to speak to the demonstration I'm doing for you who are acting as my students here. I always like to put up critical points of any type of equipment usage and to reiterate to the students they must follow institutional policy, universal precautions, identification of the patient, decontaminating the equipment between use with patients, and making sure that they document their readings correctly. And of course, as always, when we're working in institutions, to leave our clients comfortable. Pearls of pulse oximetry also, these are some of the things I think that are critical for us to make sure our students understand when they go into the clinical area, is how to detect false readings, because this is not a perfect science. Patients do have issues if they're cold or in shock, if they're in a situation where they're coding. Burn patients, of course, are going to have bright red blood due to carboxy hemoglobin buildup from smoke inhalation if that's the case, and that would pretty much make the pulse oximetry readings useless. The pulse, of course, would probably be near correct, but the saturation is not. There are special tests the physician can order, or the healthcare provider, that can give them the corrected values. Also, pulse oximetry is effective by clients with lower irregular heart rates, and pulse oximetry is a clinical profession's friend in that you're able to obtain a quick peek at the client's initial status in a dire situation. I always tell my students one of the things you can do to make your life a lot easier in the clinical area is to check your patient's pulse oximetry reading right away. Anything that is not showing you that the patient appears to be stable, you may want to go ahead and get those vital signs and get your report on that. Next, I just wanted to show you my reference for the YouTube video. It's a copyright, it's a free reuse. And then, of course, I wanted you to see that I also had put in the vital sign sheet, and then I will post to you a copy of the checkoff sheet. It's just a generic blank sheet. I hope you enjoyed this presentation. I enjoyed, of course, doing it for you. Thank you so much for your time and consideration to be appointed as an assistant professor of nursing at Key West Community College. Thank you very much.